Good afternoon, class. My name is Eric Decoto, and today I will be talking about type 1 diabetes. It may surprise you to know that in the US, there are only 9.3% people that have diabetes. It is also the seventh leading cause of death in the US. Today, I will be talking about the increased risk of type 1 diabetes on your health. Diabetes is a chronic disease that affects how your body turns food into energy. It is a disease that has an extra presence of sugar in the bloodstream. People with diabetes are at an increased risk of serious health complications, including vision loss, heart disease, stroke, kidney failure, amputation of toes, feet, or legs, and premature death. Type 1 diabetes usually occurs in children, teens, and young adults, but it can develop at any age. If you have type 1 diabetes, your pancreas isn't making insulin or is making very little. Without insulin, blood sugar cannot get cells and build up in the bloodstream. High blood sugar is damaging to the body and causes many symptoms and complications of diabetes. Type 1 diabetes is caused by an autoimmune reaction that destroys the cells in the pancreas that makes insulin called beta cells. This process can go on for months or years before any symptoms appear. Some people have certain genes that make them more likely to develop type 1 diabetes, but many won't go on to have type 1 diabetes even if they have the genes. Being exposed to a trigger in the environment such as a virus is also thought to play a part into developing type 1 diabetes. Diet and lifestyle habits is not the direct cause of type 1 diabetes. It can take months or years for enough beta cells to be destroyed before symptoms of type 1 diabetes are noticed. Type 1 diabetes symptoms can develop in just a few weeks or months. Once symptoms appear, they can be severe. Untreated diabetes can lead to very serious, even fatal health problems. Risk factors for type 1 diabetes are not as clear as prediabetes and other types of diabetes. Known risk factors include family history, which is having a parent, brother, or sister with type 1 diabetes, and age. You can get type 1 diabetes at any age, but it's more likely to develop when you're a child, teen, or young adult. Currently, no one knows how to prevent type 1 diabetes. As far as management goes, healthy lifestyle habits are really important. Making healthy food choices, being physically active, controlling your blood pressure, and controlling your cholesterol. Regular exercise can reduce risk for heart disease and other complications. Symptoms include sudden weight loss, excessive thirst and hunger, frequent urination, nausea, vomiting, poor growth, and lack of energy. If it is not treated, and a condition called ketosis can occur. Ketosis can cause coma and death. Currently, no one knows how to prevent type 1 diabetes, but it can be managed by following a doctor's recommendations. Diabetes is costly in both human and economic terms. It's urgent that you take swift action to effectively treat and prevent this serious disease.